Whenever we can provide combination therapy, it's always a benefit to the patient. Diabetes is a burden. We're asking them to be physically active, we're asking them to follow nutritional therapy, we're asking them to check their blood glucose, and then we're going to give them a host of medications. And they're already being treated for hypertension, hyperlipidemia, and they may have other comorbids that they're being treated. And now we're saying, okay, we'd like you to take a few oral agents for your diabetes, then let me add a few injectables, and anytime I can combine them and decrease their burden and their copays, that's a real win for the patients. It really is. Well, I think the problem we have is that nobody is treating prediabetes. There may be recognizing and they may not be recognizing, but part of the problem is we don't have medications that are going to take care of it, except for perhaps weight reduction medications. And most insurance companies don't pay for weight loss medications. And so we're really talking about weight loss and physical activity, and perhaps for some patients we might use some metformin. So the question is, how do we deal with the vast number of patients who have prediabetes that we know that ultimately will go on to having diabetes, and the cost and the morbidity and mortality associated with diabetes. So if we could focus on prediabetes and help those patients understand the devastations of what it would be to move on to diabetes. And I'm not into scare tactics, quite honestly, but I really do think an awareness and an education to help those patients understand what we're talking about in a reality check for not only the patients but the healthcare providers who see overweight and obese patients and don't confront it or have a conversation about it. I think we need to start really talking about cardiovascular disease. I don't think we talk enough about it. I'm in a specialty practice. I'm in an endocrinology practice. So we're looking at blood pressure, we're looking at lipids, we're looking at the diabetes. That's really where our focus is. And even then, we miss some patients in terms of discussion of their cardiovascular risk, weight reduction, physical activity, but most importantly, the use of statins. I think we really need to introduce them earlier. And there's a benefit to just about, we probably should put it in the water, quite honestly, but we really need to start talking earlier on to most patients, especially if they have diabetes, about cardiovascular disease, the need for the use of statins. So I really don't think that there's a magic nomenclature that we can have with patients, but an honest conversation. And my conversation with patients are, your greatest risk in life is going to be cardiovascular disease, and that's whether you have type 1 or type 2 diabetes. We've got these statins, we should be using them. So I think that's really where the time should be spent with patients who have diabetes and cardiovascular risk diseases.